Could you kindly introduce yourself?
My name is Jonathan Mawire, and I'm a junior pathologist at a teaching hospital here in one of the low and middle income countries in Kenya, Nairobi, Kenya.
What do you do, Dr. Jonathan?
Well, I work in mostly in diagnostic pathology, where we basically look at tissue samples obtained from patients for the purpose of making diagnosis that then is used in the management of these patients in a clinical setting.
What is pathology really?
So pathology can be looked at as science and also an art, but basically what happens in pathology is the science of making diagnosis. I think in some other areas it has been called diagnostic laboratory medicine. It encompasses a general area where a pathologist looks at samples obtained from patients and does a couple of other tests to make a diagnosis that is then used for management of these patients.
So, in your opinion, why is pathology important?
I think that those who say, I might not quote them exactly verbatim, but they say that medicine anywhere in any setup is practiced. The practice of medicine is as good as the practice of pathology, which means that you need a pathology service to be able to do a good job in terms of managing your patients properly, which means that you cannot do without pathology. So what pathology does is it provides a service to the doctor, a consultation service to the doctors who use this information that they obtain from pathologists to manage their patients. So for example, I think the best example you can use is a patient with a lump in the breast, which could certainly be anything, but a surgeon wants to find out what is the nature of this lump. Could it be cancer or could it be something else? They will use radiology to try and identify the lump, but the only person who's capable of telling them whether it's cancer or it's something else is actually a pathologist. So what they will do is they will take out the lump and they'll bring it to the lab where we'll look at it and give them an answer, and we'll not only tell them whether it's cancer or not, we'll probably tell them what kind of cancer it is, how it's likely to respond to treatment given the specific treatments that exist, and how well or how poorly this patient is going to do. So it's, if you think about it right now, it's actually essential for any hospital to have a pathologist working together with the clinical care team.
Thank you very much. So, what are the challenges you face working in a low middle income country setting?
The challenges there are many, and I think most of them are managed from the problems that exist within the public healthcare system, as well as the level of income of most of the people who are patients. So most of the patients in low and middle income countries don't have health insurance, which means they can only pay for certain things that they consider essential. Unfortunately, most people do not consider something like pathology as an essential service, so they are willing to pay for drugs because they're paying for out of pocket. They're willing to pay for drugs, they're willing to pay for an X-ray, but if you tell them that they need to pay out of pocket for a service which they do not understand, it becomes difficult. So practicing here makes it it's a bit frustrating to some extent, because there are not a lot of people who think that the service is that essential, and so most people do not utilize it as well as it should. And so I think for us that's one of the biggest challenges. The support that we get from various health institutions is not also so great, because people still do not consider pathology as a mainstream service when it comes to provision of healthcare to our patients. But I think over time that is slowly changing. People are beginning to realize that it's just as important as having a radiologist working with you, or having any other person that is involved in clinical care.
What do you think can be done to mitigate these challenges?
Well, I think a lot of it is already going on. One is education, which is critical. I think when you train more pathologists, they tend to take the service out to the people. Then people realize that it's actually an essential service that they were doing without. And the appreciation for pathology and the involvement of pathologists and the influence of pathologists grows. The other thing is to educate physicians, clinicians, because those are the people who deal directly with pathologists, patients don't. And when you tell them that pathology is more than just autopsy pathology, and that a pathologist is quite useful, a very useful resource when it comes to management of patients, and they tend to understand that when you interact with them, it's another way forward. The other thing is for the pathologists themselves to actually go out there and be part of the the processes that are involved in making policy. So when a cancer policy is being made, I think a pathologist should be there to provide that angle of things, because cancer cannot be diagnosed without a pathologist. And if you're going to make any plans on tackling cancer and you don't have the people who actually make the diagnosis, then you're already starting off on the wrong foot. And I think pathologists need to go out there and make their presence felt. And I think that is already happening in our setup. Private facilities can help in terms of, I think over the years, many, both public and private facilities haven't seen the value of pathology, but I think that is changing over time. And I think as the economy grows generally, then people can afford to have a service that initially they thought they couldn't. So it's going to get better.
Thank you very much. Are you hopeful for your profession, practicing in an LMIC setting?
Yeah, we're very hopeful. I think there's a large young generation of doctors who are full of energy, especially coming through their junior consultants right now, or they are just finishing their masters, and they are going to give us they're certainly going to make the presence of pathology felt within our setup, and that makes me very hopeful, because through things like the College of Pathology of South and Eastern, South and Central Africa, most of the work is going to be done by young people. They have the energy, they have the drive, and I think over time we are going to see the benefits of these efforts. So I'm quite hopeful, yes.
Thank you very much for your time, Dr.
Thank you.
Jonathan. Thank you.